Thank you all for joining me today to discuss the urgent issue of our state's response to the COVID-19 pandemic. Since the start of the pandemic, nearly 10,000 Marylanders have lost their lives to COVID. While our country and state have made great progress in fighting this disease over the past 18 months through vaccination and social distancing, we are still at great risk of a new wave of COVID from the highly contagious Delta variant. Today, over 400 Marylanders are hospitalized with COVID-19, and 34 Marylanders died of COVID in just the past week. These numbers have risen sharply since mid-July, and we remain highly vulnerable to a major new wave of illness and death. Now, as I stand here today, almost all COVID hospitalizations and death are unnecessary. I want to underscore this. COVID hospitalizations and death at this point are almost entirely avoidable. Vaccines are a proven solution. They are extremely effective in preventing serious illness and death and reducing COVID transmission. So we have the tool at our disposal to decisively win this fight against serious disease and prevent a new wave of hospitalizations and deaths. I am proud of the fact that Maryland is the 7th most vaccinated state in our country. But our contest is not with other states, it's with the virus. Currently, 40% of Marylanders are unvaccinated, and until those numbers increase, we remain highly vulnerable to the Delta variant. Just as we have passed laws in other areas where the evidence of public health benefit is overwhelming, such as banning drunk driving and requiring school children to be vaccinated against polio, we must act decisively to increase our state's vaccination rates against COVID. That's why I'm calling on Governor Hogan and local officials throughout the state to take bold, immediate action consisting of the following. First, we should require all state employees and contractors to show either full proof of full vaccination, or receive weekly COVID tests. Currently, the state applies such a requirement only to selected state agencies. It should be expanded government-wide and include state contractors. Second, we must act to ensure the safety of children returning to school this fall, including those under 12 who are not yet eligible for vaccination. Governor Hogan should therefore require all educators and staff from pre-K through higher education to show proof of vaccination or to be tested at least once per week. Montgomery County Public Schools and Howard County Public Schools have recently implemented vaccination and testing requirements. Such policies should be expanded statewide. Third, we should establish in-school vaccination clinics at all public middle and high schools in early fall to accelerate vaccinations among 12 to 17-year-olds with parental consent. Currently, just 51% of 12 to 17-year-olds are vaccinated. We know from the flu vaccine campaigns, that in-school clinics are very effective at increasing flu vaccination rates, and they could make a big difference for COVID as well. Fourth, the state should require workers in all indoor health settings in Maryland to show proof of full vaccination. These workers are exposed to vulnerable, sometimes immunocompromised patients, and we must do everything in our power to protect these patients from unnecessary risk of COVID. Fifth, I strongly encourage local governments and Maryland businesses to implement vaccination and testing requirements for their employees. Montgomery County has said it will soon implement such requirements for their county employees, and I urge other counties and cities to follow suit. I also encourage localities and businesses to consider requiring proof of vaccination or testing for patrons of restaurants, cafes, bars, gyms, and other indoor venues. The central theme of my gubernatorial campaign is that we must use evidence about what works and what doesn't to improve education, wages, and health in our state. In the case of COVID vaccines, the evidence is overwhelming. It is conclusive. I call on Governor Hogan and local officials to act urgently and decisively to use this proven tool to prevent another wave of serious illness and death in our state. Thank you.
John, yesterday Governor Hogan said something to the effect that there's no further action needed for vaccine mandates. Do you have a response?
Yes. So first of all, I would credit Governor Hogan. He's with some good work in this area. The state, as he points out, the state is ahead of most other states in vaccination rates. But our contest is not with other states. Our contest is with the virus. And so I disagree with the governor. I think urgent action and much stronger action is needed. Currently, as I mentioned, 40% of Marylanders remain unvaccinated. And while that is true, we are highly vulnerable to the Delta variant, and the numbers are going in the wrong direction right now. So I would urge the governor to use every policy tool at our disposal to increase vaccination rates, because that would enable us. We have the tools to win decisively against the virus. I would urge him to use them to the full extent of his power.
And John, what message do you have for unvaccinated Marylanders?
Please get vaccinated. It's good for you. It's important for the community. It's safe. It's effective. It's proven. In this country, we eradicated polio 60 years ago, and we virtually eradicated measles. Polio at one time was a terrible and dreaded disease for many, many years. We completely vanquished it through the use of a proven vaccine. We have that opportunity here to completely triumph over serious COVID illness and death. So I would urge you, for your own sake, to get vaccinated, for your own health, and also for the community, because getting vaccinated helps reduce transmission in the community, including to people who are immunocompromised and children who are not yet eligible for the COVID vaccine.